Good morning, everybody, and thank you so much for joining another one of our MAG Meet the Specialist sessions. This one is with the very lovely Dr. Rob McCartney, who is an occupational and environmental physician. These guys are sometimes also called OCPHYSs. Basically, they do whole of body systems in relation to a person's capacity to perform the duties of their work, or indeed any work, depending on the matter. Dr. McCartney's been with us for many years and also runs his own successful business, both clinically and in Medico-Legal. He's an absolutely terrific guy to deal with, and his reports are excellent. You can book him through the Mag Connect platform. So without further ado, I'll hand over to Dr. McCartney, who's going to give a little bit of insight into himself, his role, and what he does. Thank you so much, Dr. McCartney.
Yeah, thank you, Michelle, and welcome everyone, those who are with us live and those of us who are watching it later. And what I just learned on the weekend is called asynchronous communication, which means we're not live. Yeah, I'm an occupational and environmental physician. Probably the environmental physician component isn't of much use to anybody in the audience, but it is rapidly growing. Occupational physician, that's a doc who specialises at the interface of health and work. And to become that type of specialist, one does all your normal training. As a doctor, you have to do a certain number of years post-grad in the general hospital system, and then you can try and join the program. Once you join the training program, which is a subsection of the Royal Australasian College of Physicians, you then have to do 4 years of extra training, a postgraduate course, usually a master's in occupational health, a thesis that you must write of publishable quality, and then set a series of exams. It's 6 hours of written exams and 6 hours of practical exams. If you pass all of that, you'll then be admitted as a fellow of the Faculty of Occupational Medicine. Our area of expertise is that interface of health and work. And we look at all the hardcore evidence, not what we reckon, not theory, which some of my other specialist colleagues base it on, but we look at the evidence of what something's got to do with work, what is work-related and what is not. And if work is a significant contributing factor, to what degree and how much was going to happen anyway? And of that was going to happen, how much would that have impacted on a person's ability to work? We also are experts in what's reasonable and appropriate treatment for a work-related injury. That is, there's lots and lots of new technologies coming out that's really fairly theoretical. And there's lots of medications. You might have even heard of a thing called medicinal marijuana, where it's the fastest growing script being written. What of that is genuine script and what of that isn't really of benefit? So we can also provide evidence on where the science lies of genuine therapeutic benefit. So is this additional surgical procedure likely to alter the outcome? Now, for insurers, that can be of great benefit, both what's it got to do with work and is this still work related, and the component that is work-related, is this treatment reasonable and appropriate treatment for it? Depending on the jurisdiction or the state, the IME, the independent person, has a lot of sway in what an insurer does. Not all states, some that have had ombudsman reports have decided we're not going to necessarily listen to that. Some there are medical assessment tribunals that can overrule, sometimes the GP can. But in many states, that independent specialist has a lot of say as to what an insurer does with a case or what they fund with a case. And I think that's really appropriate, because the true independence is we're not there for the plaintiff, we're not there for the employer, we're not there for just the insurer. We're there to give independent opinion on where the science lays. And that should be what a good independent medical specialist does. And unfortunately, though, lots of specialists aren't trained in the actual etiology of illnesses. So what truly causes carpal tunnel syndrome and what's work-related in it is not part of the orthopedic training program. It's not part of the plastic surgeon training program. They are fantastic at fixing it through really adept, amazing skills of releasing it. The actual etiology, as you can imagine, isn't that important when it comes to releasing a compressed carpal tunnel. It doesn't mean they don't study it, but it's not the course training. Whereas we spend years ongoing looking at the evidence between what was caused by work. And that means you've got to have a good understanding of epidemiology and biostatistics. For a injured worker, of course, all of this is a bit of gobbledygook. All they know is I'm crook, I need treatment. And that's absolute fact. They do need treatment and they're crook. But when we give scientific answers, we have to look at balance of probabilities. That means you need to know more likely than not. That means you need to know things like relative risk factors of 2.0. That means you have to look at proper evidence, proper studies, and look at a data-informed biostatistics and epidemiology to work out, did this person's typing contribute in any material or significant way to carpal tunnel? So that's one core skill of ours. The other core skill is the evidence base for medical and surgical intervention, which we can offer assistance. And the other is then for fitness for work, which is a big deal sometimes when we get to the personal injury common law component of the medico-legal component. So I work for some unions on this, and I provide them with advice for their claims managers. So it'd be a misunderstanding to think that people like myself only work for defendants or for insurers. I work for plaintiff side. But what they do get from a good occupational physician is good communication skills, science and evidence. So it's logical, it's defendable, it makes sense. It's not just my opinion, it's the evidence of opinion. So there's nothing worse than someone, an old crusty doc like me, getting up and saying, well, in all my years, I've learned that this, in my opinion, is, because the problem is my opinion could absolutely be wrong. But if I say the evidence and I show where the evidence lies, that can't be wrong. It's actually evidence. It's not opinion. Opinion can be wrong all the live long day, but science and evidence cannot. That's where the real value of someone, a good scientific, good communicating occupational physician is of benefit. And then I think we had case managers, lawyers, insurers, and other doctors here. The other thing we can be involved with is that safe return to work, rehabilitation and return to work. So not just saying, can someone work? Well, of course they can. I can get into the ring tomorrow and fight the Australian Open heavyweight champion. Well, probably super heavyweight now. It's been a difficult few years over COVID for me. So the super heavyweight championship of Australia, I could technically get in the ring. But the real question is, can I do that job safely? To be able to do a job, one has to be able to carry out the essential and inherent requirements of a job without creating a foreseeable and significant risk to themselves or others. And so therefore, to make that determination, you need to have a specialist who understands jobs. And while some of my colleagues are much smarter and more knowledgeable than me about orthopedic problems and even medical problems and cardiac problems and neurological problems and psychiatric problems, they're much smarter than me about those health issues and know much more than me. They don't know more than me when it comes to the workplace. What are essential inherent requirements of the job? They don't understand the issues of having to or not necessarily, some might know it because they've learned more, but they don't know from their normal training. We need to know that in a workplace, you have to interact with other people. So if you do have psychological or neurodevelopmental issues, that can impact on ability to interact with other people in a safe manner. That's where an occupational physician can help as well. I think the core skill we occupational physicians have to have is good communication. And, you know, I often say to my registrars, all the other specialists have their area of expertise and specialty, and they're smarter than us at that. Nearly every one of them are smarter than us at the other areas of medicine. But we understand the bringing it together to be at the interface of work or workers' compensation or insurance. That's our area of expertise, our area of training. That's our house. That's where we live, and we can be of benefit. But if we don't get communication right, either verbal communication or written communication, preferably both, then we decrease the value to the community. And the community, of course, is workers, doctors, employers, insurers, lawyers, regulators, and everybody else. And that's where I think the real core skills of a good occupational physician lie. With regards to the work I do for MAG, and I'm very happy to be part of, my role there is to make sure that I understand the reason for the referral. What is the value proposition that someone's giving me their hard-earned money and handing it to me? What are they looking for? And then make sure I address all the issues, behave in a professional manner, a courteous manner. So while the examinee might not necessarily want to be there, they leave feeling they were heard. They leave feeling it was a comfortable assessment. And then my report is clear, precise, succinct. I don't think 21-page reports necessarily help anyone, and answer the questions, because I don't think you get value for money if I waffle around and don't answer a question. Over 2 pages, I leave you more confused. If a question is yes or no, it must be answered one of the two. And then you might want to clarify as to why there were some complexities in answering yes or no, but I really try and answer the specific question asked of me. That's an overview of what occupational physicians are, what I am specifically, and how I think I might be of assistance through MAG to anybody who's listening to this presentation.
That is fabulous. Thank you so much. And I think that was a really great summary and detailed explanation of what you do and why your specialty is both different and unique. I have a question for you from a colleague, and that is in relation to, you mentioned the component of environmental medicine. And we are seeing that coming into the medico-legal space more and more. And an example that I can give to you it would be, say, a guy who for the last 10 years, 15 years, has worked at Woolies driving a delivery truck. But prior to that, his first job, he was an apprentice panel beater and spray painter. He's now in his 50s and he's now getting some respiratory situation, because when he was a spray painter back in those days, they did it in like a closed garage. There weren't extracting masks, there weren't filters and all of that. And the tiny weeny particles of paint are now causing a problem, but that wasn't known then. Are you experiencing things like that in your practice?
Yeah, absolutely. Just to declare, I am the Chief Medical Officer of Woolworths, so let's make him a Coles truck driver, right?
Coles truck driver, no problem.
Yeah, absolutely. And as occupational medicine is actually a subsection of environmental medicine. So it's basically, we've got our own health internally that's constitutional, and the bad luck of genetic changes and inherited vulnerabilities. But then there's the environment out there. And the environment could be the stuff I have to lift in the workplace, or chemicals or dust I'm exposed to at work. But it could be that I smoke, my personal choice is I go to nightclubs where there's tobacco in the air. It could be that I have a hobby where I'm exposed to things. It could be that I live downwind from a large manufacturing plant that produces something in the air. It could be that we allow major arterial roads past suburbs where there's diesel particulate matter being expelled from the trucks. It could be, people might remember those little old pesky bushfires before COVID took over our world. But just before COVID, we had those horrible bushfires. That caused a lot of environmental health issues. Unraveling what's caused by background bad luck, the randomness and the thin tenure we have on life, what's caused by environmental hazards, such as the pollution in our city, or that factory over there, or that coal mine that I happen to live 100 kilometres from, or if I live on the train line that carries the coal from the coal fields to the ports. About when I spray paint, one of my hobbies is doing up hot rods, and so I spray paint at home. It's not the bits of paint that are necessarily the problem, it's the isocyanates that are thinning it sometimes that create occupational asthma. Or I might weld and grind at home. So yeah, trying to unravel all of that is really interesting. And we get elevated lead and other heavy metals sometimes from other places besides the workplace. Environmental medicine from a very low base is exploding. And people saying, me or my children are being made crook by the environment, is taking off. And COVID had a lot to do with that. We thought our shopping centres might have been safe. We thought our restaurants were safe. But then as soon as this pesky little virus came along, we suddenly realised, oh, hold on, the airflow isn't necessarily going the way we thought it was. Or what's happening in our trams or in our trains and in our buses, in our aircraft. The aircraft companies had to spend so much on this. So yeah, it's getting really interesting, the whole aspect of what out there is impacting on my health. And I think it's going to be a growing field. And it's a field of expertise and science that we didn't get taught a lot. Well, I didn't, maybe the new graduates get taught a lot in medical school. So a lot of it's got to be postgraduate study.
Wow, fantastic. Thank you so much for that informative talk. I hope you have a great rest of the day, everybody. And this recording will be up on our YouTube channel for you to view, but also for those of you who registered, you will receive the link to the recording afterwards. Thank you so much, Dr. McCartney. Have a great day.
Thank you, everybody.
Ta. Recording.